Good morning and thank you for the nice introduction, and I must thank each and every one of you and the organizing committee for allowing me to speak here. We're going to discuss something today about PRP or platelet-rich plasma. Platelet-rich plasma is not new, it's very old. In fact, it was first used to treat heart conditions. PRP was injected into the coronary so that collaterals open out and it improves the pumping and ejection fraction. As the years went by, people started using it in orthopedic surgery, in wound care, and now we also use it in aesthetic medicine. Dr. Al-Qatari has enlightened us already about growth factors, and PRP is much linked to these growth factors. Tiger Woods, he kind of made PRP famous, as when he had his injury, he publicly announced that he had taken PRP. Now, this is a photograph of a face, rather a sketch of a face. On one side, you can see a youthful face, and the other side, you can see an aged face. If you draw a line, you see there are various bumps in the line, or there are various wrinkles formed in the line. It's important for us to see this kind of a face when we talk about any rejuvenative or any procedure in aesthetic medicine. Because in aesthetic medicine, there are only two mantras. One is restore the face to the RSTLs, or the resting skin tension lines, and play with how light reflects off the face. It's pretty much these two things which every aesthetic person or every aesthetic doctor wants to do to get a perfect masterpiece, as we say. So what is platelet-rich plasma or PRP? PRP or platelet-rich plasma basically are platelets taken, mixed with a little bit plasma, and re-injected into the body. PRP has a lot of growth factors, as you can see. These growth factors, I won't go into the detail, but they help a body heal itself. They help the body recover from micro injuries. Any growth factor helps the body recover from micro injuries. As we saw in the previous lecture, we cause micro injuries by the derma stamp, and the growth factors help it. Same way PRP, if you have it in an injection, the injection itself causes the micro injury, and you inject growth factor at the site. These growth factors are your own growth factors which are produced in your body. It's important that one knows anatomy of the platelet. Normal platelet count should be done before PRP. There are many studies. Today, if you see in alternative medicine, there is a plant, it's called the papaya plant. The leaves are crushed and they are eaten. This causes platelets to rise. Of course, in science, we don't know why it causes the platelets to rise. But when we find platelets going down, we give them the papaya leaves. We also have capsules. You can get capsules of these papaya leaves. So I won't go, this is in short what the platelet growth factors do. Transforming growth factor, insulin-like growth factors. These basically help the collagen. Okay, this is an important slide. You see, when there's an injury, there's homeostasis, followed by inflammation, followed by regeneration and remodeling. This is the cascade that happens with every injury produced to the face, or every injury or insult produced on the tissue. So what are the benefits? It basically jumpstarts the healing process, because when tissue is injured, it starts to heal. So it jumpstarts the healing process, increases the level of growth factors, works with the cellular matrix, has an anti-inflammatory properties because it's also used in joint injuries. It's also used in osteoarthritis where there's a lot of inflammation. This is the way PRP is generally prepared. You take off the blood, you centrifuge it, you have two levels. On top you have the platelet poor plasma, then you have the platelet rich plasma, then you have the buffy coat, and you have the RBCs. So you take off the platelet rich plasma and you inject it. This has been done for a lot of time now, and a lot of people I think are doing PRP. So what's new? So again, these are some of the cosmetic indications. Orthopedic indications, you can use it for tennis elbow, you can use it for joint injuries, post surgery, for recovery, for healing. Some of the clinical trials which have been done in PRP, you can see. So PRP has a good advantage in orthopedics, especially after procedures, especially after arthroscopies. Okay, because it helps the arthroscopic wound to heal. So now what's new? We've taken PRP to the next level, or call it PRP lysate. What you need to do is that you draw 50 ml of blood, you process it, you take off the platelets. Once you take off the platelets, as we said, platelets have the growth factors. We lyse these platelets in liquid nitrogen by freezing and thawing them. After they are lysed, we call it PRP2X or platelet lysate. This has a higher concentration of growth factors, and these growth factors can also be stored. You can store it in the freezer, you can freeze and store them for up to 6 months, so they can be used for the next patient after thawing. If you have liquid nitrogen access at your clinic, it's much better to store them in liquid nitrogen. Now this, you need a clean room, you need a lab, you need a lot of things to do this. This cannot be done in a simple, a simple clinic kind of setting, because you need access to microcentrifuge, you need access to liquid nitrogen. So we have put a small innovation in which we have developed this device. If you see, it has 12 concentric circles, and each sector is divided into 12 subsectors. Blood, it's a laser point here. Yeah. Blood flows from here, has a lateral force going out. This has a space, or a filtration space, of 0.02 micron, which is just enough to break the platelet and allow the growth factor to trickle down. So you have your growth factors, you have your PRP in the syringe, you pass it through this. This is your mini lab. This does your freezing and everything, but mechanically, because of the lateral force exerted on the platelets, and it comes out from here. So you just need a clinical centrifuge. It's a single-use thing, so you have to use it. It's a single patient use. You cannot store it, or you cannot use it again and again. You cannot keep using it. This is the whole assembly. If you see, this is the PRP. Okay, passing through this, you see how clear it is. All the debris, cellular debris, everything is trapped inside this. Everything is trapped in this device, and you get the pure platelet growth factors over here. Now these growth factors can be injected directly, or you can store them. This is the entire sterile device, so it's a closed system. You can go intra-articularly. We use it for hair, we use it for skin. I'll show you some of the results.